Good evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight,
hospitals are again fighting the battle that we had hoped would be behind us by now.
Governor Pritzker brings back the indoor mask mandate as the Delta variant spreads. A look at what data on COVID infections is and isn't getting collected.
Cook County public defenders will soon be able to represent immigrants facing deportation. We have the details.
Life is difficult. Wrestling's hard.
A Garfield Ridge wrestling organization is helping empower youth with life skills.
How babbling baby bats may shed light on the evolution of language. That and other stories from the world of science.
I'm Angelito, and coming up tonight, we've got dance lessons with Lipizzan stallions.
And Cook County's Palos Preserves is now designated as one of just 3 urban night sky places in the world. This is still a Lipizzan stallion, though. We'll tell you how to best enjoy the darkness.
And Brandis and Paris, as you mentioned, I'm in the Garfield Ridge community area tonight as part of our latest Chicago Tonight in Your Neighborhood series. On Chicago's southwest side, Garfield Ridge is home to Midway Airport. We spent the day here speaking with community leaders, including about concerns about that Delta variant and the coronavirus, but also we talked to the head of an organization that's empowering youth through wrestling. Lots more ahead, but first, back to you.
Amanda, thank you. But first, some of today's top stories. The chaotic situation in Afghanistan escalated today as 2 suicide bombers and gunmen attacked crowds of Afghans flocking to Kabul's airport, killing at least 60 Afghans and 12 U.S. troops. U.S. officials say 11 Marines and 1 Navy medic are among those who died. Another 12 service members were wounded, along with 140 Afghans. The Islamic State group has claimed responsibility for the attack. The affiliate in Afghanistan is considered far more radical than the Taliban, who recently took back control of the country.
If we can find who's associated with this, we will go after them. We've been clear all along that we're going to retain the right to operate against ISIS in Afghanistan. And we are working very hard right now to determine attribution, to determine who is associated with this cowardly attack, and we're prepared to take action against them. 24/7, we are looking for them.
Now, the first explosion happened at what's known as the Abbey Gate of the airport. The second at or near the Barron Hotel, where many people were told to gather before heading to the airport in recent days. Evacuation flights continued to take off from the Kabul airport even as the area was hit. And starting Monday, everyone in Illinois will be required to wear a mask in indoor public spaces. And within 2 weeks, more workers will be required to get vaccinated. Governor J.B. Pritzker and the state's public health director made the announcement today, citing rising COVID cases.
Vaccination remains our strongest tool to protect ourselves and our loved ones, to restore post-pandemic life to our communities, and most crucially, to maintain our healthcare system's ability to care for anyone who walks through their doors that needs help. I'm sure that if people understood that being unvaccinated could take a hospital bed from an accident victim, they might go get vaccinated. Unfortunately, we are running out of time as our hospitals run out of beds.
Pritzker cites low vaccination rates in parts of the state, as low as the teens, though more than 65% of all Illinois residents are vaccinated. The vaccine requirement applies to pre-K through 12th grade teachers and staff, as well as higher education employees and students, plus healthcare workers across various settings. They will have to receive at least their first dose of the vaccine by September 5th or undergo weekly testing. The mask mandate applies to everyone over the age of 2. And the Chicago Public Health Department says its local hospital capacity remains stable despite the downstate surge that's leaving only 3% of ICU beds available in southern Illinois, for example. CDPH says less than 10% of ICU beds in the city are filled by COVID-19 patients. While 85% of the city's ICU beds are in use, the vast majority of them are occupied by non-COVID patients. Up next, how public health officials are monitoring breakthrough COVID cases. Stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
As we just reported, Governor J.B. Pritzker is bringing back Illinois' indoor mask mandate. As the Delta variant drives a spike in COVID cases, 2 reports in the last week outline the challenges of tracking so-called breakthrough COVID cases in fully vaccinated people. And they suggest breakthrough cases are more prevalent than previously thought. Both Politico and ProPublica say the CDC is not, in fact, tracking breakthrough cases, which it had originally intended to do. Instead, it's only gathering data on the most severe breakthrough cases. And joining us to discuss the importance and limitations of disease surveillance is Dr. Mark Dworkin, Professor and Associate Director of Epidemiology at the UIC School of Public Health. He previously worked for the CDC in Atlanta and was the Illinois Public Health Department's state epidemiologist. Dr. Dworkin, welcome to Chicago Tonight.
Thank you very much.
I want to start with the news of the day. Mask mandates for all state employees, vaccine mandates for K through 12 teachers in the state. Your reaction?
Well, I mean, nobody likes a mandate. Nobody likes to need a mandate. And you can argue about whether or not you need a mandate. But the bottom line is that masks are a basic, simple way to block transmission of the virus. And we know that masks are helpful. We've used them all the time for other diseases, and we are using them successfully for interrupting COVID transmission. With the rise in cases that's occurring now, it makes sense that we should try to do something at a public health level to interrupt it. And mask mandate is one of the things that needs to be considered and sometimes used.
And Illinois is approaching 70% of adults vaccinated. The nation is approaching that too. It had previously thought to be herd immunity level. Is that the case now, or has that changed with the Delta variant?
Well, when we talk about so-called herd immunity, we know that projections suggested something like 70% might be good, but we never knew precisely what was going to be needed. It was, educated guesswork. And one thing that's definitely different now is that the predominant circulating, what they call variant of COVID, is different than it was when they were first looking at this. The infectiousness of this germ is much greater now. And so the so-called herd immunity is therefore further pushed higher. We need a higher percent. And we don't know precisely what it is. We just know that it's clearly higher.
And speaking of how infectious this disease is, or this variant is, we keep hearing of more and more breakthrough cases. The CDC has held that it's extremely rare, something like 1% or 0.01%, but then these reports in ProPublica and Politico we mentioned indicate that the CDC actually didn't track all breakthrough cases, just the most severe. So why was that the tack that they took?
Well, I mean, I wasn't in the room when the decisions were made, but the kind of thinking that would go on would probably have to do with the fact that there's going to be more and more cases of breakthrough as we have more and more people vaccinated, because breakthrough cases are cases in vaccinated people. So the more people are vaccinated, the more total number of breakthroughs you can have. It can still be a small number, but if it's a small number of millions and millions of people, it's still a lot of people. And a lot of people means a lot of work is necessary in order to track the cases, because there's work to be done each time a case is identified. You have to both identify that they have been diagnosed, and you have to match that up with vaccine history. And these two things can be laborsome, especially when you're doing it in health departments that are very strained by dealing with the COVID pandemic and all the work that's involved. So it's very likely that CDC was considering what can we do well versus what do we ideally want to do, which would be to monitor all the breakthrough cases. What can we do well? We can better monitor and understand the sickest ones, the ones who are getting hospitalized.
So, and that is what they're monitoring. What does the data tell us from what they've discovered about those cases?
Well, I mean, I don't have the latest data from CDC, but the kinds of things that we learn from this kind of data and that have come out in some reports already, is that older people, which we would have expected, are more likely to be among the breakthrough cases who get hospitalized, and people who have underlying immune problems, let's say like lupus, or people who are on steroids, or maybe transplants patients. These people are more likely to end up getting hospitalized when they have COVID, even if they were fully immunized. So these are the kinds of factors that they might more readily get that information and be able to then study it when they're hospitalized. We have ready access to the medical record in those situations.
Certainly important information to know, especially as we hear now that vaccine efficacy is waning a bit as the months progress from a person's second shot. In general, what sorts of surveillance systems are in place at CDC and local health departments, and do they communicate with each other? Because you mentioned how difficult it would be to take on the task of matching everyone's vaccination status with all the new COVID cases.
Right, and it's not that it can't be done, it's that it's a huge amount of work to do it on a giant number of cases nationally. But in terms of like what kind of surveillance systems already exist, there are dozens of diseases that are infectious that are currently what we call reportable. And that basically means that the hospitals and laboratories and healthcare practitioners are supposed to report those specific diseases to the local health department or state health department. And then they voluntarily share this data with CDC without any names, for example, or identifiers.
And that is, as you said, is a massive undertaking. Go ahead.
Yeah, so I was going to say examples of that would be like salmonellosis, salmonella food poisoning, or botulism. These are examples of day-to-day diseases that are undergoing surveillance. HIV would be another one, mumps, measles, rubella. These are all diseases that are reportable.
So in normal times, health departments and epidemiologists have their hands full with these diseases, and now with COVID, we can see how strained they all are. All right. Our thanks to Dr. Mark Dworkin. Thanks so much for joining us.
You're welcome.
And as we mentioned, COVID cases are rising. Vaccination is lagging in certain parts of the city. That includes Garfield Ridge. The Southwest Side community's got a growing Latino population. More than half the neighborhood's residents are Latino. It's also a community that many first responders call home, and an area that includes Midway Airport. Our Amanda Vinicky and producer Marissa Nelson spent the day there for the latest in our Chicago Tonight in Your Neighborhood series, and Amanda joins us now. Amanda, what do you have?
Well, Paris, I want to actually start the introduction to Garfield Ridge with somebody that we met after he was randomly walking down the street. Walter Gowell had just paid a visit to a Chicago classic, Weber's Bakery, where he'd bought kolachki and apple turnover. And he has been here for a long time. His parents bought a house in Garfield Ridge in '55, and he's pretty much lived in that very home ever since. He remembers when the house was one of only 3 on the block, when some of his neighbors were farmers, and when cows, as in the actual animal, not the cows on parade statues, were a common thing to be seen walking down the street.
With the Grand Trunk Railroad, they used to ship in the cattle for the back of the yards, and when they used to break out of the trains, the cows used to come through the neighborhood, and they come back on horseback to try to round them up.
Now, Gowell likes his neighborhood, his neighbors, but he's not exactly thrilled with, he says, some recent changes, graffiti, car speeding. Garfield Ridge does have an active neighborhood watch. El Cachetolo started it about 10 years ago.
You still have people that go out certain evenings, certain afternoons, and they ride their bike, they might walk, they might drive their car, and they're just being the eyes and the ears for the police.
Now, a lot of police do live in Garfield Ridge, but crime really not rampant here. Cachetolo says living in Garfield Ridge is like living in the suburbs. Another member of the watch, Yanya Taylor, has family ties to the community, but she chose to live here in part because of its location, close to I-55, and also because she says she likes living in the city without living in the thick of it. Now, if there is an incident, she says that the watch is really careful to verify that this isn't hearsay. The They check details with the police and with any victims before posting anything on the Watch's active social media. But while the Watch began and was about initially keeping the neighborhood safe, that's no longer its focus.
Over the years, it's grown into more of a community organization. So we've gone from patrolling on the streets to holding large events. So we do 2 community yard sales a month or a year. We do events like the car show, which we've taken over. We do a huge Christmas event here at Wentworth Park.
She tells us that Santa makes an appearance and goes through many streets, visiting lots of neighbors. So moving on to one of those streets, Archer Avenue is a main artery through Garfield Ridge, and that is where we met the president of the Chamber of Commerce, who says that the Chamber is here to support the multi-generational businesses that have thrived, made it through a recession and a pandemic, as well as new ones popping up. She says, however, that COVID has, of course, been hard. There is the cost of PPE, having to close, and now staff shortages.
They say that there's all these grants out there that are available, but I have a lot more businesses on Archer Avenue who say that they have applied, and they have not received any grant money whatsoever. And most businesses here on the Southwest Side and anywhere, they're not looking for a handout. We just want to conduct business the way we've always been taught: be good, provide a good service, provide a good product, be fair, treat people fairly, and we expect the same in return.
Now, speaking of COVID, the rate of the coronavirus in the 60638 zip code is 5.7%, and 49% of residents, according to city data in that zip code, are fully vaccinated. Now, in contrast, there's a 4.2% positivity rate in all of Chicago, and nearly 55% are vaccinated citywide. Dr. Eunice Kim is a family physician whose clinic is in Garfield Ridge, and she is working to bring that rate of vaccination up. Parents and youth over the age of 12 who are coming in to get their back-to-school physicals, she is ready to give them that shot.
I just want to stress that we are here for our patients in this Garfield Ridge community. So whenever they decide for themselves to protect themselves and their families and friends, we are here to support their decision. And if they have any questions, we're here to answer for that too. In terms of the vaccines, it is highly effective against the new Delta variant too, above 90%. I mean, when I was back in school, above 90% is A.
Garfield Ridge-based Beat the Streets is also looking out for Chicago's youth. The organization takes boys and girls age 5 through high school to the mat, the wrestling mat.
Wrestling is probably the best fit because life is difficult, wrestling's hard. It's not easy when you first get into wrestling. You're going to get your butt kicked. And you're going to take a lot of beatings, but through perseverance, hard work, dedication, learning how to fine-tune your craft, slowly and surely you get better.
Dixon says Beat the Streets is about helping to develop children off the mat as well. So yes, there is a weight room and obviously the mats, but this is also a program that offers tutoring, literacy help, and life coaching. And they've got this brand new place to do it. $2 million of renovations toward this building that just opened in June as Beat the Streets headquarters. Now, next month, Beat the Streets starts its new fall program. You can register on its website. And we, of course, want to say thank you to Beat the Streets for taking us off the streets this evening with some storms in the forecast. Now, we'll be back later with Garfield Ridge resident and also the local alderwoman, Sylvana Tabares. But for now, sending it back to you in the studio.
I'm sure a lot cooler and drier in there, Amanda. Thanks so much. And now to Brandis and a new law aimed at helping Cook County's immigrant community. Brandis.
Paris immigrants facing deportation in Cook County will now be able to access legal representation from public defenders starting in January. A pair of bills signed by Governor J.B. Pritzker provides not only legal counsel, but also public information campaigns so immigrants and refugees will know their rights. Joining us to discuss the impact of this new legislation and what it means for the community are Hina Mansouri, head of the immigration unit at the Cook County Public Defender's Office, and State Representative Jennifer Gong-Gershowitz. Thank you to both of you for joining us. So, Representative Gong-Gershowitz, let's start with you, please. You were a sponsor of both of these two bills. Why did you think they were necessary?
Well, these pieces of legislation, both of them, are fundamentally at their core about ensuring basic justice and fundamental fairness. You cannot exercise rights that you don't know that you have, and the consequences can be devastating. And, with respect to access to representation, everyone deserves representation in a courtroom, especially when the stakes are as high as they are in an immigration case. Immigrants are incredibly vulnerable. They may struggle with English, be unlikely to have legal training or experience with the American court system. And it can take years for a trained attorney to master the skills necessary to handle a complex immigration case. And yet we're asking individuals threatened with deportation to essentially defend oftentimes, the equivalent of a death penalty case in a traffic court-like setting. And so this gives the Public Defender's Office the option of representing immigrants in the removal proceedings, providing consistency in representation and access to justice.
And Hina, from your perspective, how does the Public Defender Bill impact the way your immigration unit can operate?
Sure. So our immigration unit was actually just launched in fall of 2020 with the goal of being able to provide a more robust representation to the non-citizen clients that our office has. And part of that is assisting them when they are in criminal proceedings. And then the second part of that is being able to continue representation of those same individuals when they are placed in removal proceedings. So our goal is to be able to provide a more holistic approach to representing individuals who may have criminal cases arising in Cook County. And the two systems are, very closely intertwined. Criminal cases have a grave impact on individuals' immigration options, and somebody's immigration status can, of course, affect what they're able to do and how they may encounter the criminal justice system. And so we felt that we really needed to have a holistic approach towards taking care of these clients so that we can address both of these needs. And to do that, this bill will allow us to continue representation.
And State Representative Gong-Gershowitz, from your opinion, as an immigration attorney, how does having this legal counsel affect an outcome for someone who's facing deportation?
Well, it's dramatic. Yeah, I think most recently I read a study by the American Immigration Council, which found that among detained immigrants, the difference between having representation and not having representation came down to, a matter of almost 2 times being more likely to succeed if somebody had access to counsel. In cases where an immigrant was not detained, the study found that success was almost 5 times more likely when somebody had access to counsel. So the results, in the cases aren't dependent on the merits. The merits of the cases are the same, whether you have representation or you don't have representation. The difference is your ability to articulate the merits of your case. So as I said, having access to counsel has a dramatic impact in the success of someone obtaining relief. And as I said, the merits of the case are the same. The difference is in your ability to articulate a complex legal standard with access to representation.
And Hina, you said, of course, your office, your unit is it's still fairly young, but how have you all started working towards implementing this right to representation model in your office?
Sure. So we're in the process of staffing up our unit. We're actually working on interviewing over the next month or so. I've been, considering what our representation model will look like so that come early 2022, when we're able to go into immigration court, we'll have a model set up, know how clients will be able to get in touch with us, seek our representation, et cetera.
Got it. And this public defender bill came out hand in hand, of course, with a push for more public information campaigns in high traffic areas. Representative Gon-Gershowitz, do you believe that there has been a lack of this public information for refugee and immigrant communities until this point?
Yeah, absolutely. Prior to coming into the General Assembly, I worked in immigration for over 2 decades, and it was always devastating to me to see somebody come in who would essentially waive their rights because they didn't know how to assert them. They didn't know that they had rights, and oftentimes were presented with documents and information that were not presented to them in a language that they could understand. I had cases where somebody had signed their own removal order, which in immigration cases is incredibly hard to overcome. And they couldn't understand what it was that they were signing, didn't know that they had the right to obtain counsel and have something explained to them. So the consequences for not understanding your rights can be devastating. And this is a simple matter of education. I don't think there's many Americans who can't recite the Miranda warnings, right? You know, we've all seen you have the right to remain silent on television and courtroom dramas. This is something that we consider to be fundamental to due process and fairness. And yet for the immigrant community, oftentimes left without knowing that they even have rights to assert. So for me, this would be a game changer in ensuring that those who are most vulnerable know that they have rights and can assert them.
Okay, we'll have to leave it there. Our thanks to Hina Mansouri and State Representative Jennifer Gon-Gershowitz for joining us.
Thanks so much for having us.
Thank you.
And up next, we check with Amanda Vinicky, who's reporting live from Garfield Ridge. Stay with us.
It really is about community where we all come together.
Chicago needs to make space for everyone.
Checking back in now with Amanda Vinicky, who spent the day reporting in Garfield Ridge as a part of our In Your Neighborhood series. Amanda.
Brandis, earlier today, I caught up with the 23rd Ward Alderperson, Sylvana Tabarez. She doesn't just represent Garfield Ridge, she lives here too, as do a lot of first responders. So I started off by asking her about policing, including how the community is, as it is still reeling from the killing of police officer Ella French. Here's more.
Well, first of all, last year I voted no on the budget because it's wrong to cut funding for the Chicago Police Department. And now we find ourselves that the police officers are forced to work 12-hour shifts with barely enough time to sleep, let alone see their families. The city of Chicago needs to recruit more police officers. I want to see more police officers in the 23rd Ward. Residents do not feel safe. We need to fund police department, we need police recruitment, training, and we need to improve the morale. We need to improve the morale within the Chicago Police Department because officer wellness and community safety go hand in hand.
How do you respond, however, to residents that say, I don't want more police in my neighborhoods, they make me feel more unsafe, or is that not something that you get from your constituents?
I work with our local district commander in the 8th district, and I worked with him to purchase multiple cameras in the ward, for the ward, out of my district allotments, because it is going to help police to do their jobs, to help keep us safe.
Yeah, I know that was an issue that aldermen were having to give money that would otherwise be spent on infrastructure and instead put it toward police cameras. Are you hearing enough from Superintendent David Brown for what he needs in order to boost morale, hire more officers?
I made it very clear when we called the hearing back on July 1st. We had that hearing over the July 4th weekend. I expressed my concerns about officer wellness, about the 12-hour shifts. I'm not going to vote for a budget that's going to cut funding for public safety. We need funding for our police department, and I'm also not going to balance the budget on the backs of homeowners like those in Garfield Ridge.
So some of those homeowners, many of them are elderly. Are you getting a lot of questions as the Delta variant is very much here about boosters, vaccinations? What are you telling people, particularly these senior residents that are concerned?
We need to focus on accessibility. because the easier we make it for residents to get vaccinated, we need to encourage residents to get vaccinated. We see progress by encouraging residents. And I find it that when we make the process easier, it's easier for residents to get vaccinated. And that's what the city needs to be focusing on.
Is the city doing enough there?
Well, last year, I'm going to tell you something. In March, we had a vaccination here in Garfield Ridge. It was at Hale Park. We partner up with the city, and we vaccinated more than 500 residents, particularly senior citizens over the age of 5. I'm working to get another vaccine event and flu shot this fall here in Garfield Ridge, because you do have these seniors who want to get vaccinated near their home. And that's what I mean. We need accessibility. We need to encourage residents to get vaccinated.
Now, the governor just announcing a mask mandate, and then in select cases, vaccination requirements statewide. The mayor also now saying that this is required of all city workers, getting some pushback from unions. Where do you stand? Should vaccinations be required for city employees, including officers?
Yes, no, like I mentioned earlier, we need to focus on accessibility. Okay, we need to encourage residents to get vaccinated. Because what I find is that I find it easier. When you find the process to make it easy process, you also find it easier you find residents to do it. And so that's what the city needs to focus on, is accessibility.
Encourage, not require. Encourage, not mandates.
Encourage, not mandates. Mandate is not a right approach, and I hope that the city and the unions do come together to figure something out that will be supportive of the city workers, because many of them, like our first responders and our police, have been working hard since the beginning of the pandemic. They don't have the work from home. They have been out there in the front lines keeping us safe.
Now, gearing up, of course, for some city council budget battles there, but Tabarros's office teaming up with the Garfield Ridge Neighborhood Walk to host a fundraiser, Get Behind the Vest, early October 3rd, I believe. Now, we'll be back again with somebody from the city's aviation department as we hear planes from Midway flying overhead. For now, back to you.
Amanda, I've been told there's a watch party going on right there in Garfield Ridge. So
Amanda, actually, that was a very impassioned interview with the alderperson there. Thank you so much. We'll see you in just a bit. And now, Paris, we go back to you.
I'm very sorry about that. Thank you, Brandis. And still to come on Chicago Tonight, looking for a place to escape city lights, a local forest preserve is now an official urban night sky place. What that means and how to best enjoy the darkness. What babbling baby bats may tell us about the development of language, and what simulated rat whiskers can tell us about touch. That and more from our Science Story Roundup. And history lessons and dance lessons with the Lipizzan stallions in a new performance. Arts correspondent Angel Ito has the story. But first, some more of today's top stories. Reaction is pouring in tonight to Governor Pritzker's announcement of a statewide mask mandate and a vaccine mandate for all state K-12 teachers. Retail, business, and manufacturing groups are supportive of the mask mandate. The Illinois Retail Merchants Association in a statement says, quote, "We ask all customers to abide by this public health order in a respectful manner." The Illinois Manufacturers Association and the Chicagoland Chamber of Commerce also say they support the mandates. Meanwhile, the state's largest teachers union signed onto the vaccine mandate, saying that it's, quote, "the best course of action for education of our state's youth." The governor and Illinois Public Health Director Ngozi Ezike announced today the mandates, citing rising hospitalizations and the need to control the rapidly spreading Delta variant.
The bottom line is masks are effective. Vaccines are effective. But until more people are vaccinated, we need to take the steps to protect our healthcare workers, protect our hospital resources, and protect our most vulnerable.
Unemployment decreased in all Illinois metro areas, including Chicago, last month. This according to data released today by the Bureau of Labor Statistics. The Chicago metro area saw unemployment dip from 13.3% last July to 8% last month. That's a drop of 5.3%. Statewide, unemployment went down from 12.4% to 7%, a dip of more than 5%. Supplemental federal unemployment benefits are set to expire at the end of this month. And now to Brandis for details into a unique designation for a local forest preserve. Brandis.
Paris, thank you. Palos Preserves in southwest Cook County has a lot to offer. Trails for hiking and biking and hills a rare commodity for Chicago. But now the preserves are known for another feature only available after sunset when the gates close. It's darkness. WTTW news reporter Patty Wetley joins us now with more. So Patty, Palos Preserves gets dark, so dark that it's received a new designation from the International Dark Sky Association, which we will come back to in a minute. But first, tell us, what is this designation and how unique is it?
Yeah, it is now an official urban night sky place. It's one of only 3 places in the entire world with that designation. And what that means is that it's a place where you can find an authentic nighttime experience, even in the midst of a lot of artificial light, which obviously comes from Chicago. So it's not saying that it's like as dark as someplace in the wilderness or Alaska, but it is that, according to folks at the Adler Planetarium, emits 1,000 times less light than downtown Chicago. So considerably darker, and you can see 4 times as many stars in the Palos Preserves as you can in the city.
Oh, wow. Okay, so let's talk about the International Dark Sky Association, because it sounds like something out of a superhero movie.
Right.
What is it?
It is an organization that promotes the conservation of dark skies. So thinking of darkness, dark skies as being as rare as some habitats. So they really advocate against light pollution. And for the forest preserves, that means that they've implemented a lot of indoor and outdoor lighting things that kind of dim the impact. From an ecological standpoint, it's so important because we know how birds migrating can be impacted by so much artificial light. It throws off animals' mating and feeding habits. Humans are affected by it. Our rhythms get thrown off by so much light pollution and artificial light. So really what the Forest Preserves and the International Dark Sky Association is doing is trying to tamp that down and bring back the darkness.
Okay, so before we let you go, Patty, if one wanted to visit these newly certified dark skies, because the park is closed, how would one do that?
Yes, ironically, the preserve does close at sunset, but, they do have campgrounds there. So you can have a complete immersion overnight experience in the dark. And the preserves are also going to partner with Adler Planetarium on bringing some dark sky activities to the park, like sky gazing, so we can see some of those meteors I'm always telling you about and we can never see in the city.
All right. Well, and we expect you to report back if you go out on that experience. Patty Wetley, thank you so much for joining us.
Thank you, Brandis.
And you can read Patty's full story on our website, WTTW.com/news. Up next, bats, rats, and cuttlefish. That's right. That and more in our roundup of science stories making waves. Stick around.
Coverage of science and technology on Chicago Tonight is made possible in part by Joel M. Friedman, president of the Alvin H. Baum Family Fund.
Babbling baby bats, simulated rats, the impressive memory of cuttlefish, and why, contrary to popular belief, some key mental abilities appear to actually improve with aging. Joining us now to help us understand some of the latest science stories in the headlines is University of Chicago paleontologist Neil Shubin. Neil, great to see you as always.
Great to be here.
All right, so let's start with that bat story. Researchers at the Smithsonian Tropical Research Institute have found that baby humans share a very interesting trait with baby bats. What is that?
Yeah, so this team was looking at bats, the sack-winged bat from Panama and Costa Rica. And what they would do is watch them in the wild, in their natural settings. They'd watch them develop. And it turns out the baby bats learn vocal signals from their mom, but they do so by a form of babbling, much like humans do. That is, they'll repeat a syllable over and over again, like da, 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 or ma, 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 like different consonants, obviously, they use, but something like that. And then they learn from their mother as they begin to babble. They begin to refine their language as they babble.
And as I think we have some sound of that babbling, so let's play some of that sound as I ask you this next question. So is this babbling a trait that's unique to humans and bats, or are there other animals that develop language like this?
Well, so far within mammals like us, which have hair and so forth, it's the bats and the humans. But it turns out that birds can do it as well, though they have a different kind of vocal learning. And so it's pretty, there it is, that's pretty cute. It's pretty amazing.
It does sound a bit like a bird. So that's a baby bat there. Does this tell us anything about the evolution of language in general?
It does. It shows us that the roots of language run very deep, that they run outside our own species, that even bats and probably other mammals as well do this, so that the roots of language precede the evolution of our own species. So that's really fabulous.
So a lot of species are talking to each other in their own way. All right, let's move on to cuttlefish. A team of international researchers discovered that cuttlefish retain very sharp memories of specific events in old age. How do we know that?
Yeah, they're really remarkable. These are smart animals. They live about 2 years, and we know it because these researchers have...
So old age for them is relative.
Yeah, no, they live 2 years, but that's old age for them. It's like they're 90 by like 23 months, the equivalent of 90. But the thing about it is that they tested these cuttlefish. What they did is they put up little signals where food would be. And they did that over a period of time. They varied those signals, but they trained them in some ways, but they also varied them in others. Turns out that the cuttlefish were able to remember these signals throughout their lives, up into the day they died. So unlike humans, where short-term memories can disappear, in cuttlefish, they don't.
Very interesting looking species there. Is there any theory as to why their memory is so good in old age?
Yeah, so they store their memories in a slightly different way, in a different way than us. We store our short-term memories in a region of the brain called the hippocampus, which degenerates as we get older. That's why sometimes as we hit age 50, 60, 70, we have a hard time finding names. Well, cuttlefish do it in a slightly different way. They have a different structure to store their short-term memories, one that doesn't degrade as they age, which is pretty remarkable because the rest of their bodies age significantly in terms of their strength, their vitality, their vigor, but not their memories.
Speaking of memory and mental ability when we age, there's a study out of Georgetown University Medical Center that says, contrary to most of our collective belief, that there are some elements of memory that improve in human aging or as humans age?
Yeah, thank goodness, right?
Yeah.
I mean, so we were just talking about how short-term memory can degrade in humans. Well, what this team did is they gave individuals ages 58 to 95 a test. And this test required them to really think on their feet very rapidly. And it turned out some aspects of attention and memory actually get better with age. Others decrease, so it's a mixed palette, but it was a really remarkable discovery.
Okay, so what are the aspects that get better versus the ones that decrease? Well, you mentioned short-term memory decreases, obviously, but what gets better?
Yeah. Okay, so think of driving. There's 3 different components that are active when you're driving and hitting an intersection. One is alert, the other is orientation, and the other is executive function. So in terms of alert, if you're approaching the intersection, the alert phase says, aha, I'm approaching an intersection. The next is orientation. If there's a passenger in the intersection, orientation is when your brain focuses you on that passenger. The third is executive, and executive allows you to filter out all the other signals to focus on that passenger, independently. Filter out all the other sensory information to focus on that pedestrian. And so in this case, what you have is the alert function is decreasing in function, whereas the orientation and the executive ones are increasing. So it's pretty remarkable, and that was a very, very statistically significant signal over aging.
So maybe more focus and better decision-making as you age. Does this have any implications for Alzheimer's or dementia research?
Well, the feeling is that these are learned, that the reason why we get better with these as age is not because our brains are necessarily working physiologically better or neurobiologically better, but it's because we have learned these things. We retain that learning over time. So perhaps by reinforcing these kinds of things in elderly people and aging brains, that we can prevent deterioration in some ways.
All right, last story, certainly not least, rat whiskers. Northwestern University did a simulation of a complete rat whisker system. What is the purpose of researching rats' whiskers?
Rat whiskers are really amazing, okay? Rats, they don't use their eyes as much as they use their whiskers. Their whiskers, they have about 70 of them, sticking out of the front of their head, of different shapes and different sizes. What they do is they allow them to see their environment through the bending of these hairs. It's almost like sight in them. And so somehow the brain is integrating all the signals from these different whiskers, these 70 different whiskers, to give a sensory picture of the world in rats. It's a really remarkable thing. And what the Northwestern team did is they said, well, we can't really study these things in living rats because they're too small. We can't do that. What we can do, however, is we can model them mathematically. So they did a 3D scan of the rat's whiskers. They vary in shape and size. And then they modeled what happens to them as the rat would enter different environments, as it put its head in a pipe, as it walked around a room, as it whisked around different shapes. And they were able to show how a rat can perceive shape and size and movement of air through its whiskers.
And the researchers in this article said it might shed light on, quote, the mysterious nature of human touch. How so?
Yeah, think about it. Let's say you're in a dark room and fumbling around with your hands, and you're against the wall, and you're looking for that light switch. What's happening? You're sensing that room through your hands, through your touch, and that is an incredibly complicated set of systems there that are working. Touch is amazingly complicated because it's tied to how we use our hands, how we use our bodies. It's tied to the motor piece as well, how we use our muscles. Think about holding a coffee cup. You know, without a sense of touch, you'd drop the cup. You would either squeeze it too hard or too soft. So it's tied to so much of what we do. Touch is really underestimated, but extremely important.
Well, I'll have a newfound appreciation when I see the rat outside my building scurrying toward the dumpster as to what that rat can teach me about human touch. All right, Neil Shubin, thank you as always.
My pleasure. Good to see you.
Good to see you too. And up next, more from Garfield Ridge as part of our In Your Neighborhood series. But first, a look at some events happening this weekend. And now we check back in with Amanda Vinicky, who spent the day reporting in Garfield Ridge as part of our In Your Neighborhood series. Amanda.
Maybe this weekend or next for the Labor Day holiday, you're planning to travel, perhaps taking a flight out of Midway. We have with us now Elizabeth Granados Perez. I want to get this title right. You're Managing Deputy Commissioner for Midway Operations, also, by the way, a Garfield Ridge resident. So thanks for joining us. Now, of course, early in the pandemic, the travel industry was devastated by COVID and restrictions. So what was the impact like for Midway, and has it rebounded?
Well, first of all, thank you for having me here this evening. I really appreciate it. Yes, the airport, just like every other airport, was definitely impacted by the pandemic. But as history has shown us, the aviation industry as well as the airlines have rebounded through many other challenges, and so we're confident that they are going to rebound through this challenge as well. Midway Airport itself stayed open during the height of the pandemic. It continued to service our traveling public. I would like to note that Midway actually was one of the airports that rebounded quicker than others due to its leisure and domestic travel destinations. And one other quick fact is that in 2021, we actually have had days where the traveling figures have equaled or exceeded 2019 numbers, which were pre-pandemic. And so that gives us all hope that we are headed in the right direction.
People really ready to get somewhere else after staying at home for so long. And of course, you probably had to make some changes operationally to make sure that both employees and passengers were safe. What about operations?
So first and foremost, I'd like to say that the safety and health of our passengers as well as our employees is first and foremost for us. So with the support of Mayor Lightfoot, we did work with the Chicago Department of Public Health as well as our partner agencies to ensure that we had guidelines that protected the employees as well as our passengers. And so what we've done is we encourage social distancing. So we have signs throughout the entire airport, as well as markers on the floor to ensure 6 feet of distancing. We have installed hand sanitation units throughout the entire airport, and we encourage masks. So masks need to be worn in the airport.
And also, I know there's low-touch concessions available. Before we run out of time, though, I really want to touch on, there was a construction project done here over Cicero related to Midway. So what impact does that have on security checkpoints?
So our Midway modernization program has continued through the pandemic, and we were able to open up the new security pavilion. It is 80,000 square feet. It is 7 times wider than the previous pavilion that we had. And the TSA throughput has increased from 2,500 passengers per hour to 5,000 passengers per hour. So it is a new, great amenity that I hope everyone can come out and see.
Makes it a lot easier, faster when you can get through security quickly when you are looking to travel again. Perhaps you are looking to do so coming up for the holiday weekend in early September. Thank you so much again. That was Elizabeth Granados Perez with the city's aviation department. And wow, time flew. Back to you guys.
Time flew. I saw what you did there, Amanda. Thanks very much. And up next, dance lessons with the Lipizzan stallions. But first, we take a look at the weather.
There's a farm just north of the city that's working to preserve an equestrian art form you might have seen at this summer's Olympics. Arts correspondent Angel Ito takes us to Temple Farms and the Lipizzan stallions they're teaching to dance.
We're trying to keep the art form alive. We're trying to keep the training and the history involved into current day. We're one of the few places still doing it.
It's at Temple Farms in Old Mill Creek, Illinois, that a rare horse breed known as the Lipizzan stallion is trained in dressage, or a form of equestrian riding.
They all have different styles, different techniques. We have work-in-hand horses, long-rein horses, horses that are in the quadrille. This horse is the solo horse, so he shows all the movements of the high school in front of the crowd by himself. So we always take some of our most talented horses and develop them into solo horses.
Now, it's usually about 4 years before a Lipizzan stallion, like Cookie here, begins their formal equestrian training.
A lot of people don't realize the amount of time that we put into these horses before they're ready to perform. It is a lifelong endeavor for both the riders and the horses.
Now, the relationship is built over a 5 to 6 year period, with trainers working with the horses for about an hour a day. Once they've got their routines down, it's showtime.
In the center, we have Aurelia. She's a 16-year-old mare with very unusual markings.
The show? Weekly dance recitals, of course. It's the newest educational opportunity offered by Temple Farms, where attendees can learn more about the art form.
This breed was established 400 years ago.
Beginning with the youngest of our herd, our foals, we moderate basically what it is about the Lipizzan horse that enables it to do what we call dancing, which is dressage. So we actually show from young horse to intermediate horse to advanced horse what it is that the rider's doing.
Program Director Esther Bonanno narrates these weekly recitals. And while she's not a trainer, Bonanno says it's both the horse's natural ability and curiosity to adapt to this art form that makes her proud to educate people on this historical legacy.
These stallions learn to work with one another, next to one another. They learn to not just move on straight line and circles, but to cross their legs over in really elegant ways. We even do a pirouette in dressage, so that rather than doing a circle on a straight line, they are now doing a circle, carrying themselves on their hind ends. And then what we even do here at Temple Lipizzans, which is not done anywhere else here in the country, is the airs above the ground. And these are former battle maneuvers stylized into an art form where you actually see horses jump up off of their feet and kick in the air.
I love it. Show attendee and former rider Kathy agrees. She says to witness the Lipizzan stallions perform in person is truly a once-in-a-lifetime experience.
They emanate a presence and an energy and a power
and to see the way they listen to their trainers. I don't think that you can ever fully capture classical riding unless you're right here.
For Chicago Tonight, I'm Angel Ito.
Interested in learning more about how the Lipizzans dance, classes continue through the beginning of September on select Wednesdays, Saturdays, and Sundays. We have ticket information and more on our website. And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that's our show for this Thursday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
And you can also get the show via podcast and the PBS video app. And please join us tomorrow night at 7 for the Week in Review. Now, for all of us here at Chicago Tonight, I'm Paris Schutz.
And I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm named on the 2021 expertise list of the best personal injury attorneys in Chicago.